Good evening everyone. Today we are going to see about the ossification centers for a long bone. According to the law of ossification, the primary centers for a long bone appears before birth in the shaft of a long bone. And then the secondary centers appears after birth, either in the upper end and then the lower end of a long bone. So now we are going to see about the femur. The primary center for femur appears in the shaft of femur at around 7th week of intrauterine life, whereas the secondary centers, there are 3 secondary centers for the upper end of femur. One for the head, and the second one is for the greater trochanter, and then the third one is for the lesser trochanter. So the first secondary center for the head appears at around 6 months to 1 year of intrauterine life, whereas the second secondary center for the greater trochanter appears at around 4 years of age, and then the third secondary center for the lesser trochanter appears at around 14 years of age. Now these secondary centers, they unite with the shaft at different ages. The lesser trochanter unites with the shaft at around 16 years of age. The greater trochanter unites with the shaft at around 17 years of age, whereas the head unites with the shaft at around 18 years of age. So, what about the neck of the femur? The neck of the femur, it is actually formed from the primary centers as an extension of the shaft. Okay, the neck, it is formed from the primary center as an extension of the shaft of femur. Okay. Coming to the secondary center for the lower end, it has some unique feature. Like usually the secondary center, they have to appear after birth, but here it appears just before birth. That is around 9th month of intrauterine life. It has got some medicolegal importance because it shows the maturity of the fetus. So secondary center for lower end of femur appears just before birth at around 9th month of intrauterine life. Coming to the growing end of a femur. Coming to the growing end of a femur, it is actually in the lower end of the femur, you have the epiphyseal plate. The epiphyseal plate, it is actually seen along the adductor tubercle. Adductor tubercle is also unique. It has got some importance. That is, it is used as an important surface marking to locate the femoral artery and then popliteal artery. It is seen in the bone at around 5 cm above the medial epicondyle. It is present 5 cm above the medial epicondyle, and then it is used as a surface landmark to locate the femoral artery and then popliteal artery. It also gives attachment to the ischial part of the adductor magnus. The adductor magnus has 2 parts. One is ischial part of adductor magnus, another is the adductor part of adductor magnus. This adductor tubercle gives attachment to ischial part of adductor magnus. And then it also represents the growing plate, that is the epiphyseal plate. It is located along the adductor tubercle. Okay, and then the epiphyseal plate, it is replaced by the bone by around 20 years of age. It is replaced by the bone at around 20 years of age. And then for the neck, for the upper end also, you have the epiphyseal plate. It is initially placed horizontally, and then over a period it becomes oblique. It is initially horizontal, over a period it becomes oblique. About the osteology of femur. Okay. So it is the longest and strongest bone in the body. It has got an upper end and then body, which is called a shaft of femur, and then you have got a lower end for the femur. So coming to the upper end, here you can see a rounded structure. This is called as head of femur, and then you have this part. This is called as neck of femur, and then you have some elevations here. This is called as greater trochanter, and this is the lesser trochanter. Now coming to the surfaces, it has an anterior surface, posterior surface, and then superior surface. And then you can see some line along the anterior surface. This is called as intertrochanteric line of femur, which extends posteriorly, and then it continues as the spiral line of femur. Okay. Now, and then posterior surface. Along the posterior surface, there is a crust. It is called as intertrochanteric crust, which connects the tip of the greater trochanter with the lesser trochanter. Along the intertrochanteric crest, there is a tubercle that is called as quadrate tubercle. And then you can see some depression here. This is called as trochanteric fossa. Now we are going to see about the muscles attached to the upper end of the femur. The important muscle attached to greater trochanter includes the piriformis. The piriformis, it is attached to the tip of greater trochanter. And then along the anterior surface of the greater trochanter, it gives attachment to gluteus minimus muscle. And along the posterior surface, it gives attachment to the gluteus medius muscle. Okay. Now, there are muscles attached to the trochanteric fossa. The three tendons attached to trochanteric fossa are called as tricipital tendons. The tendon of superior gemellus, and then you have the tendon of the obturator internus, and then the tendon of inferior gemellus. Piriformis, superior gemellus, obturator internus, and then inferior gemellus. All these muscles are called as minor muscles of the gluteal region, whereas you have the gluteus maximus, gluteus medius, and then gluteus minimus. All these are called as major muscles of the gluteal region. Okay. They take origin from the hip bone and they are inserted into the femur. Coming to the lesser trochanter, you have the muscle attached to the lesser trochanter. The important muscle attached to the lesser trochanter is the psoas major. The psoas major tendon is attached here. It is also called as the key muscle of posterior abdominal wall. What is meant by a key muscle? The key muscle is where you have the nerves and then vessels related to the anterior, upper surface and lower surfaces, or it can pierce the muscles and then it can have the orientation. So it is called as key muscle. So one of the key muscle of posterior abdominal wall is the psoas major, which is attached here. Okay, so it is a muscle of the posterior abdominal wall. The tendon is attached here, and below the lesser trochanter to the attachment of psoas major, you have the iliacus muscle. The iliacus muscle is attached here, and then to the quadrate tubercle, the muscle attached is quadratus femoris. It is different from quadriceps femoris. This is quadratus femoris, which also belongs to the minor muscle of the gluteal region. And then coming to the shaft of femur. Now we are going to see about the shaft of femur and then the importance of the intertrochanteric line. Okay, first we'll finish about the intertrochanteric line. There are two important ligaments attached to the intertrochanteric line and then two important muscles related to the intertrochanteric line. The important ligaments are, one is capsular ligament of the hip joint. The capsular ligament of the hip joint is attached along the intertrochanteric line. One more ligament is iliofemoral ligament. The iliofemoral ligament is the strongest ligament in the body. And then the two muscles attached here are to the upper part, it gives attachment to the vastus lateralis. And in the lower part, it gives attachment to the vastus medialis muscle. We are going to see about the surfaces, borders, and then muscles related to the shaft of femur. When we come to the shaft of femur, it has three surfaces and then three borders. The three surfaces of shaft of femur are, one is anterior surface, then you have a medial surface, and then you have a lateral surface. And then the borders are, there is a medial border, there is a lateral border, and there is a posterior border. Three borders, medial, lateral, and then posterior. Three surfaces, anterior surface, medial surface, and then lateral surface. So muscles attached to the shaft of the femur. Along the anterior surface, it gives attachment to the vastus intermedius muscle. It gives attachment to the vastus intermedius muscle. And then coming to the posterior surface, the important line here is called as linea aspera. The important elevation along the posterior surface is called as linea aspera. The linea aspera, when you can see the linea aspera, you can make a lips. That is the sharp margins along the linea aspera. It has got a medial lip, there is a lateral lip, and then there is an intermediate lip. Three lips, medial, intermediate, and then lateral lip of linea aspera. And then you can make out the shaft. It has a triangular surface in the upper area, and then there is a triangular surface in the lower part of the posterior surface of femur. And this surface is called as popliteal surface. The lower triangular surface on the posterior side of femur is called as popliteal surface, which forms the floor of popliteal fossa. Not only that one, the popliteus muscle is also takes origin from the popliteal surface. Okay. And then coming to the linea aspera, it has got so many importance. Okay. Why it is very important is, it is going to divide the thigh muscle into three compartments. The three intramuscular septum, which is attached to the linea aspera, divides the entire thigh muscles into three compartments. What are the three compartments and what are the three intramuscular septums? The three compartment muscles are, one is anterior compartment of thigh, and then you have the medial compartment of thigh, and then you have the posterior compartment of thigh. What are the three important intermuscular septums? One is medial intermuscular septum, posterior intermuscular septum, and then you have the lateral intermuscular septum. Now, from medial to lateral, you have the arrangements of muscles related here. First, we'll start with the vastus medialis. The vastus medialis is attached along the medial side, okay, medial side along the medial surface, and then the medial lip of linea aspera gives attachment to medial intermuscular septum. The intermediate lip gives attachment to posterior intermuscular septum, and then the lateral lip gives attachment to lateral intermuscular septum. The muscles attached between the medial lip and intermediate lip, in the upper part it gives attachment to adductor brevis, in the lower part it gives attachment to adductor longus, and then still more lower you can see the attachment of the adductor magnus. Okay, and then between the intermediate lip and the lateral lip, what are the muscles related are? It gives origin to the short head of biceps femoris, and also the vastus lateralis is attached along the lateral aspect of the posterior side of femur. So from medial to lateral, it is vastus medialis, medial intermuscular septum, and then you have the adductor brevis, adductor longus, adductor magnus, and then you have the posterior intermuscular septum, and then you have the origin of short head of biceps femoris, then you have the vastus lateralis, then you have the lateral intermuscular septum. Nearly 9 structures are related to the linea aspera. We are going to see about the lower end of femur. The lower end of femur, it has projections. This is called as medial condyle, and this one is called as lateral condyle, and it has some surfaces. The anterior surface is called as patellar surface, and then the posterior surface, the triangular surface, is called as popliteal surface, and the inferior surface is called as condylar surface. Along the posterior surface, you can see a depression here. This is called as intercondylar area. The intercondylar area, it gives important attachment to the cruciate ligaments. So you can easily remember as LAMP, L-A-M-P. So the lateral condyle gives attachment to anterior cruciate ligament, whereas the medial condyle gives attachment to the posterior cruciate ligament. And then the popliteal surface of the femur, it forms the floor of the popliteal fossa. And also it gives attachment to the capsular ligament of the knee joint. And then the lateral head of gastrocnemius takes origin from the posterior surface of the lateral condyles. The medial head of gastrocnemius takes origin from the posterior surface of the medial condyles. Okay, and then you have the plantaris muscle that also takes origin above the lateral head of gastrocnemius. Okay, coming back here, the popliteus muscle, the one muscle which is intracapsular in origin, that is popliteus, also takes origin from the popliteal surface of the femur. Okay, coming back to the anterior surface. So the anterior surface of lower end of femur, this is called as patellar surface, that articulates with the patella. Okay, and then you can see the projections in the medial condyle. This projection in the medial condyle is called as medial epicondyle. And then when you trace the medial epicondyle above along the posterior surface, this line is called as medial supracondylar line. And then the line along the lateral epicondyle is called as lateral supracondylar line. Medial supracondylar, lateral supracondylar line. The medial epicondyle gives attachment to the tibial collateral ligament, otherwise called as medial collateral ligament. And then the lateral epicondyle gives attachment to the lateral collateral ligament, otherwise called as fibular collateral ligament. Okay. And then coming to the adductor tubercle. As I said earlier, the adductor tubercle lies 5 cm above the medial epicondyle, and it gives attachment to the ischial part of the adductor magnus, and then it represents the epiphyseal growth plate, and also it is marked as an important surface landmark to locate the femoral artery and then popliteal arteries. Okay, thank you.